hard to get mental health care in Ontario, but it's even harder if you're a Black youth, with mental health providers saying that the disjointed mental health care is failing to meet the needs of Black youth in Ontario. With Alice Wiafe, the president of Black Mental Health Canada, telling the CBC that there aren't enough Black providers. And Tiana Fonte Coleman is the co-author of a new study that shows that Black youth are facing continued barriers to accessing mental health care, with youth and mental health clinicians noting that the more mental health help that you need, the harder a time you seem to have getting it. And part of this is due to the fact that Black youth have compounded issues that aren't seen in other parts of the population. With one mental health care provider saying there's so many issues no one wants to take ownership of that person and say, yeah, I will treat them. And the pandemic exposed and worsened long-standing health inequalities that researchers have shown to disproportionately impact communities of color. Let's not forget that during COVID, Black people and other people of color made up 83% of reported COVID-19 cases in Toronto. By the end of July of 2020, 21% of reported cases affected the Black community, which only made up 9% of the city's overall population, with Black youth experiencing anti-Black racism both beyond the sector and inside of the sector itself. And that colors their experiences, both deciding when to seek care and when they would get care, with the senior manager of Black Health Strategy at CAMH saying that the current mental health system is fragmented. A lot of providers aren't really talking to each other because the system isn't set up for information sharing. This is leading many families to having to figure it out on their own, with many Black youth noting that they feel as though they are being gaslit by their white mental health professionals, noting that they have to continue to insist and repeat themselves, which gets exhausting. It's hard to get mental health treatment when your mental health professionals don't believe you. And as a society, we need to encourage and facilitate more Black people getting into mental health programs, as these Black youth will be more comfortable sharing with a provider who has an immediate understanding of their situation, with there being a push for mainstream organizations to diversify and work with Black-led groups. And it's very easy to think that in Canada, we're all equal in healthcare, but that's not necessarily true, with a 2020 report showing that Black youth wait more than double the amount of time as white youth do to access care. Because if they can't get you through the door, you don't have help.